Heavy periods and severe pelvic pain? It might not just be regular period cramps. In fact, you could be dealing with something much more common than you think, right inside your uterus. Up to 30% of women in their reproductive years have uterine fibroids, but half of them don't even know it. By the end of this video, you'll know exactly what signs to look for and when you should actually worry. Let me explain what's actually going on. Uterine fibroids are growths that develop from the muscle tissue of your uterus. And before you panic, no, they are not cancerous. They are benign lumps that can grow slowly or rapidly, fueled by your body's natural hormones. What most people don't realize is that fibroids come in all shapes and sizes. They can grow inside the uterine wall, bulge outward, or even hang from a stem-like structure. Some women have just one tiny fibroid, while others have multiple large ones. Here's the surprising part. About 50% of women with fibroids have absolutely zero symptoms. You might go about your daily life, going to work or the market, completely unaware until a doctor accidentally spots one during a routine pelvic ultrasound. But for the other half, symptoms can be highly disruptive. The most common sign is very heavy menstrual bleeding. If you're constantly changing pads or feeling extremely exhausted and dizzy, a sign of anemia from blood loss, this is a major red flag we look for. As fibroids grow larger, they take up space. Think of it like a balloon inflating inside your pelvis. This causes a heavy, aching pelvic pain and sometimes a noticeable increase in your lower stomach size. Some women even look like they're a few months pregnant. Because the uterus sits right next to your bladder and bowels, a large fibroid can press heavily against them. This explains why you might suddenly need to rush to the toilet all the time, or why you're struggling with severe constipation and painful bowel movements. Many young Malaysian women worry about fertility. Fibroids can sometimes cause painful intercourse, make it harder to get pregnant, or lead to complications like premature delivery or a higher chance of needing a cesarean section. But don't worry, many women with fibroids still have perfectly healthy pregnancies. Now, there is one acute situation you must not ignore. If a fibroid attached by a stem twists on itself, it cuts off its own blood supply. This causes sudden, severe abdominal pain, nausea, and fever. If this happens, you must go to the emergency department immediately. So, how do we find out for sure? When you visit us at the clinic, we'll listen to your symptoms and perform a physical exam. Often, a simple and painless pelvic ultrasound is all we need to confirm the size, location, and number of fibroids. The important thing to remember is that fibroids rely on estrogen and progesterone to grow. That means once you reach menopause and those hormone levels naturally drop, your fibroids will often shrink on their own. For many older women, the symptoms completely disappear. Now that you understand the cause, let's talk about what you can do. If your fibroids are small and aren't causing you any pain or bleeding, we usually recommend a watch and wait approach. A routine yearly ultrasound is generally enough to keep an eye on things. If you are experiencing pain or heavy periods, there are medical options. We often prescribe specialized painkillers, oral contraceptive pills, or a hormonal IUD. These don't make the fibroids vanish completely, but they do an excellent job at controlling the heavy bleeding and cramps. For very large or severe fibroids, surgery might be needed. A myomectomy removes just the fibroids, preserving your womb if you still want children. A hysterectomy removes the entire uterus, which is a permanent cure. Your doctor will help you choose the best option for your lifestyle. If you've noticed heavy bleeding or pelvic pressure, don't suffer in silence. Come visit our doctors at Klinik Temasya for a consultation. This video is for educational purposes only, so please consult your doctor for personalized advice. Leave your questions below and check out our video on managing period pain next.